Meeting of the Board of Commissioners to order. Please stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our prayer for the morning. Heavenly Father, we beseech your divine guidance in this meeting. Keep us ever mindful of our obligations. Grant us, dear Lord, wisdom, tolerance, and courage, that we may well serve our county and fulfill our trust. Amen.
Amen.
Steve, could I have a motion to approve the minutes?
Yes, move to approve the minutes of August 3rd.
Second.
Got a motion and a second. Any discussion? Roll call, please.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes. We'll move on into our resolutions. First up, we have Andy Conrad, our highway engineer, and standing in is Dan Becker.
Morning.
Good morning, Dan.
Good morning.
Just one resolution today for your consideration. We'd like to close Lake Road between Lafayette and University Boulevard. And then our permits for the week, obviously.
Move to approve.
Second.
Got a motion and a second. Any discussion? Roll call.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes.
Thank you.
Thanks, Dan.
Appreciate it.
Next, we have Amy Lyon-Galvin, our Assistant County Administrator. Good morning, Amy.
Good morning. I have 13 resolutions for your consideration this morning. The first resolution's amending the appropriation measure resolution. The second resolution is amending the 2021 appropriations resolution by transferring appropriations. Third is authorizing the quarterly cash transfer for the County Home Levy Fund. The fourth is authorizing the county auditor to transfer funds from various county department accounts to the Medina County Print Shop revenue line item. The fifth is authorizing the county auditor to transfer funds from various county department accounts to the gasoline rotary fund. Sixth resolution is creation of a Family First Council family-centered services and support fiscal year 22 fund and authorizing appropriations. The seventh is authorizing the acceptance of an Ohio Department of Rehabilitation and Correction grant agreement. This is for fiscal years 22 and 23 reinvestment and incentive funding. The eighth resolution is designating financial institutions as public depositories. This is an activity we go through every 4 years with the Treasurer's Department. The ninth resolution is rescinding Resolution 21-0755 and approving the amended operating agreement with Aramark Correctional Services for commissary services at the jail. So after that original resolution was adopted on July 27th, they suggested some amendments that met the approval of the prosecutor's office and the county sheriff. So this is just a replacement of that previously approved agreement, and it changes the term dates to begin August 1, 21 through July 31, 26. The 10th resolution is authorizing the purchase of 7,000 gallons of regular unleaded gas for the engineering center. It's to Ports Petroleum for $2.1595 per gallon. The 11th resolution is authorizing the Medina County Sheriff's Office to purchase a new cargo trailer. This is part of their activities that they're looking to use with their Ohio EPA Recycle Ohio grant. So this will transport folks to go out and do the litter patrol from April to September, and equipment. The 12th resolution is allowing expenses of county officials. You'll see there's activity for the auditor, the probate court, and the sheriff's office. And the last and final finance resolution is the 13th, allowing claims and approving them for the week in the amount of $1,700,071.25.
Move to approve the 13 resolutions.
Second.
Got a motion and a second. Any discussion? Questions? Roll call.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes.
Thank you.
Thanks,
Thank
Amy.
you.
Next up, we have Holly Murin, our Human Resources Director. Good morning, Holly.
Good morning. On our personal changes resolution today, we have 1 new hire in maintenance, a promotion in commissioners, 3 rate increases, 1 at Job and Family Services and 2 in sanitary, a leave of absence in Job and Family Services, 2 resignations, 1 in sanitary and 1 at Office for Older Adults.
Move to approve.
Second.
Got a motion and a second. Any questions? Roll call, please.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes.
Thank you.
Thanks, Holly.
Thank you.
Next, we have Scott Miller, our County Administrator. Good morning, Scott.
Good morning. I have 3 resolutions for you today. The first resolution is accepting the material terms of the One Ohio subdivision settlement. This is pursuant to the One Ohio Memorandum of Understanding and consistent with the terms of the July 21st, 2021 National Opioid Settlement Agreement. So the state of Ohio, through its Attorney General and certain local governments, through their elected representatives and council, separately engage in litigation seeking to hold the opioid pharmaceutical supply chain participants accountable for the damages caused by their misfeasance, nonfeasance, and malfeasance. And whereas a settlement is being proposed to the state of Ohio and local governments by distributors to resolve governmental entity claims in the state of Ohio using the structure of the One Ohio MOU and consistent with the material terms of the July 21st, 2021 agreement. And whereas the Board of Commissioners of Medina County find it to be in the best interest of the Medina County to participate in this agreement. The second resolution is authorizing an agreement with the City of Wadsworth. This is for the housing of equipment, allowing for the redundancy in the county's 911 dispatching operations. This agreement is for a period of 5 years at a cost of $425 per month or $5,100 per year. And the final resolution is authorizing an agreement with the City of Madonna for chief building official services. This agreement allows both their chief building official and our chief building official to cover for each other when they're on vacation or if they're out sick or unable to perform their duties of conflict of interest.
Move to approve all 3 resolutions.
Second.
Got a motion and a second. Any discussion? Roll call, please.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes.
Thank you.
Thanks, Scott. Next, we have Jeremy Cinco, our Sanitary Engineer.
Good morning.
Good morning, Jeremy.
3 resolutions for consideration today. The first is authorizing the sanitary engineer to enter into agreement with GPD Group for professional design services. This is over at our substation tower site where we're looking to build a new tower. Boundary survey, topo, wetland delineation, and some soil borings. The second resolution is authorizing the sanitary engineer to enter an agreement with Rolling and Hoser for professional design services. This is for the sanitary sewer extension along Fixler Road east of Ridge Road that was requested by the property owners. And last is approving the amount of unpaid utility bills for the Medina County Sanitary Engineer and providing for their certification in accordance with sections 6103.02 and 6117.02 of the Ohio Revised Code.
Move to approve all 3 resolutions.
Second.
Got a motion and a second. Any discussion?
Yeah, I just want to comment. I'm glad we're moving forward with the design services. I think we know that there's a lot of money that's already starting to work its way through at the state level for infrastructure. We also know that with the infrastructure legislation is working through in Congress, there's a lot of money coming forward, and I think those that are ready to utilize it will be ahead of it. So I'm glad we're getting ahead on these. So, and I know that the highway engineer and the one tranche of money, readiness to proceed is a good indicator. Actually, I think it's one of the criteria that makes it more favorable.
Correct. Same with the Department of Development as well.
Exactly. And so I think that's exactly what we need to do, is start pushing forward and getting everything in line to be able to go after these dollars.
Yeah, we're trying to get project ready.
Exactly right. Exactly right. So, well, thank you.
Roll call?
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes.
All right, thank you.
Thanks, Jeremy. Next up, we have Denise Testa, our Planning Services Director.
Good morning.
Good morning, Denise.
I have one resolution for your consideration of accepting and awarding a bid for the City of Brunswick Jefferson Lincoln Resurfacing Project to Specialized Construction Incorporated. This is one of our CDBG projects.
All right, move to approve.
Second.
Got a motion and a second. Any discussion? Roll call, please.
Hambley?
Yes.
Weather?
Yes.
Hudson?
Yes.
Thank you.
Thanks, Denise.
Thank you.
Okay, we will move into our department updates. First, we have Laura Toth from the Office for Older Adults. Good morning, Laura.
Good morning. Thank you. We continue to be in full swing with our congregate meal provision in Medina and Brunswick. Our restaurant voucher program in Wadsworth still is not up and running. We are a bit at the mercy of Suprema Senior Center. Their cafe is not yet open, and our last contract was all of our contracts have been with the cafe. So we really want to see that through and see what they're going to do before exploring what other options we may have in the Wadsworth area. So that's still on hold. But the community response to the congregate meal starting back up has really been outstanding. We served over 180 congregate meals in Medina and Brunswick for the remainder of July. We didn't even start till July 12th, so that's a really good indicator that things are getting back into where we want them to be. We anticipate a continued heavy response to lunches being served. After Labor Day, our Wednesday lunches will return. Those are our donated lunches from different organizations and agencies and facilities throughout the county. They come in and talk about their services and donate a lunch. That's going to start back up after Labor Day. We were going to start our Friday meals back up after Labor Day. There might be a little hitch in that as our kitchen supervisor has resigned, so I'm hoping to fill that spot. Fridays is really all on us. We take that responsibility, order that food, cook that meal, so there might be a little hold in that while we're switching positions and hiring somebody new.
Do you have an apron?
Do I have what? You know what? I worked in food service probably like the first 12 years I was an employee anywhere, and it's funny the skills you bring back. I'm like, I was like, I'll never do that again. Oh, yeah, you will. Of course I have an apron. I've done the meal, so. Our home delivered meal program, because we started the congregates, that number went down in July, but we still maintain a significant increase compared to our pre-COVID deliveries. Currently, we're maintaining 7 routes and 170 participants in the meal program, and our pre-pandemic numbers were about 130. So there's still a significant increase. I don't know if we'll continue to see it go down, but I think we might see consistency or even a little increase in the numbers given where we are right now with the pandemic. So we shall see. Any questions about meals?
Yeah, I actually have a question. Have any conversations with the health department or with other centers that are also doing congregate meals, the impact of the new Delta variant, as well as the expectations, whether it might end up going back to what we were doing before?
No.
Okay.
We have not.
Yeah.
We are following the CDC recommendations as far as, but they're recommendations, so we're not yet telling people that they're required to mask in the agency. I don't know if we'll go back to that. I certainly hope, and I don't anticipate any closing or restricting of any programs, but I continue to keep a close eye and in contact with my staff about what steps we might have to take. And actually, seniors have come in and asked, do we need to mask? And a lot more seniors are wearing their masks. It is still optional at our agency, but there's no mask shame. You want to come in, you wear a mask. I have staff that wear masks everywhere. That's absolutely fine. But we are not requiring it again yet at this time.
Laura, do you have any feel for how many or percentage of the seniors are vaccinated?
99. I would say everybody. I mean, people are, that is obviously a little bit, of a joke, but people are very excited to say that they're vaccinated. I do know that seniors in Ohio, it's about 85% of seniors over there. Absolutely.
The county might even be close to 90.
Yeah,
absolutely.
I looked at the dashboard yesterday, and it is close to 90 of those that are senior population. The lowest is, and those are under 30. vaccine and under 18 for sure. There's only like 30%, I think, that are. Yeah.
When the vaccine came out, January, February, when I volunteered at the health department, and it was calling seniors to get them. I mean, they're very, very excited to get this shot and be able to. I think that gave them a sense of freedom to be able to get out and about. So the participation rate as far as vaccines is very high.
Mm-hmm. Excellent. Good. That's good.
A couple more things. On July 16th, our office received the results of our yearly fiscal audit of our Title III grant utilization. All items reconciled. There were no findings and no additional recommendations. So our fiscal department, which is one person, but continues to get high marks. Just yearly, these audits come back of our handling of our Title III grants very well. So that's good. The move of Adult Protective Service over to Office for Older Adults continues to progress. We've hired an APS supervisor, which is currently that person is in a position as a children's services worker and is coming over. So actually JFS will be losing 3 employees, but they've forgiven me, I think. We are putting the finishing touches on our contract with JFS to get to have Adult Protective Services over with us, and we've been working with maintenance to get the offices ready to go physically and technologically with wiring and phones and things of that nature. If you haven't been over, I know our parking lot is in its last phase, so there's a big part closed off, but there is access to the building. If you haven't been over, please stop over. The overhaul of our courtyard area is complete, and it's absolutely beautiful. I hope you get a chance to see the new landscaping. We already have groups that are meeting down there. We're bringing exercise groups out. It's just really beautiful, so if you get a chance even just to pop by and see it, it's really impressive, and the seniors love it. They're so happy. They're like, that's just wonderful. So it was a big boost to the morale of not only our agency but also to the seniors who come in. Finally, I want to mention a couple of activities. Our last curbside meal for the summer is scheduled for the 25th. Parking lot bingo continues August 19th in Brunswick. And in Brunswick on September 23rd, I think this is the cutest thing. On September 23rd, they're going to celebrate fall and make apple dumplings and then show the apple dumpling gang. I just thought that was the cutest activity. I'm like, I'm going to go up and participate in that. We have our luau planned for September 10th. I did bring flyers. There you go. If you could take one. Please share it. It is open to the public. It's from 11 to 1. We will have a farmer's market. We are catering a lunch of barbecue chicken, sweet potatoes, and coleslaw. We have Island Jeff playing the steel drums, and it'll be a big tent out on the lawn, and we're really excited to get that going September 10th. So pray for no rain, but we'll have a nice tent. Thank you so much.
Thank you, Laura.
Thank you.
Next up, we have Phil Titterington from the Alcohol, Drug Addiction, and Mental Health Board.
Good morning, and
Good morning,
thank you for
Phil.
giving me the opportunity here. It's, I follow Laura every time I come, and she has such a great report. But in all seriousness, we share the same building. So if you're not aware, they're underneath. And, I mean, every day, it's a joy to see. They're always hopping. And where my window is, I see the seniors who come and pick up the meals, and then half the time they're out there delivering. She's got her staff. It truly, they do a great job. And I mean, seniors in Medina County are truly blessed that it's that there. I mean, coming from my end, we see a lot of isolation, especially in seniors, and we can send them down, or we can work with that. So, I mean, you guys do a great job, and no, she didn't pay me for that. So today, once again, thanks for the opportunity. I just want to provide a little bit of update on all the services, and also where my window is the landscaping that they did downstairs. It's much nicer now, and I can see it, and it does. It provides that smile when they come and they see. So nice job there. Also, I give credit to Stephen and the maintenance crew. because doing not only what they're doing with Office for Older Adults, but that parking lot, you're doing it in phases, and you're doing it with people coming in and out and clients and things, and they've done a nice job. It really has. I wouldn't go as far as saying it's beautiful. I'll save that for the flowers, but it's very nice, and they're doing a great job. So do we appreciate that?
Asphalt can be, right?
It's beautiful on my tires, so we're good there. Just want to provide you a little bit more an update, and you talked, Commissioner Hambley, a little bit about the new Delta variant. COVID concerns are going up again, the worriness, the mental health. We're starting to see more of a long-term effect, not only on adults, but on youth. We're seeing more individuals who are requiring a higher level of treatment or services. And unfortunately, what we're also then seeing is we're seeing a big workforce shortage. Now I see, you drive around and you see a lot of signs out there for people hiring and things, and especially in the behavioral health field. So for the last couple of years, we've started to see a very large decline in individuals who are even going into the field, let alone those who are getting certified. And now we're seeing an even greater people who are stepping out of the field. Trauma, they're dealing with COVID. It's a tough field. So through my office, we're working and creating a coalition to look at the behavioral health, look at the workforce, working with Ohio State Extension, working with the ESCs, working around to figure out how we can locally instill once again or do some kind of a campaign to get students and people interested in the field. We're also working with the state and how to retain current employees and stuff, but it's a struggle. So a lot of what we do is we try to really manage capacity issues. How do we get creative? How do we work with existing clinicians without burning them out, and meet the needs of the youth? We have a couple big mandates that are coming down from the state specific to youth services that working in conjunction with Jobs and Family Services and Family First Council. These mandates are coming down, and we're trying to do what we can to meet. So trying to put out a lot of fires with the needs there. So just kind of give you, despite the shortage in workforce and working with capacity, we've still done a lot. So I'll give you some quarterly reports. So for this last quarter of fiscal year 2021, Ohio Guidestone had 825 clients who are active in services. 59% are adults, 41% are youth. Alternative Paths had 4,677 clients who are active. 91% are adults, 7% are youth. Catholic Charities had 115 clients who are active in services. 88% are adults, 12% are youth. Now, like with Catholic Charities, they serve additional as well. These are the ones that Adam Board helps pay for and things. So. And we continue to meet with the agencies, Catholic Charities, Alternative Paths, Guidestones, get creative. How do we attract? We live in a great county. How do we compete? We're basically, it's that supply and demand. Demand for services is up, supply of workers is down. We're competing with hospitals, we're private, telehealth, and it's very difficult, but it's a daily struggle. I joke because the CEOs of these agencies really are interviewers. That's all they do is they just keep, attracting and interviewing and trying to get people in the door. And those that they get sometimes don't stay because somebody, money or something else, a better offer in their mind comes. So what those numbers just equal is there are 5,617 clients that were served during this last quarter. 86% were adults, 12% were youth. So as you can see, they're working hard. They're doing the best that they possibly can. And this is really critical, was the Human Services Levy. This is what I'm reporting on. It's allowed us the flexibility to not only get creative with attracting workforce, but also some of the providing crisis services, other services that really don't have any other funding sources. So we do appreciate that once again from the voters and the commissioners as well. The 24/7 Crisis Behavioral Helpline. That is one that we use levy dollars to pay for and to help. Over this last quarter, they had 923 calls or engagements on that on the hotline. 71 individuals verbalized suicide thoughts. So the line reaches out, we connect, and we can intervene at that point. There were 40 active rescues that occurred. So what that means is the hotline got a service, got a clinician, got somebody out to where they needed to be. A lot of times it could be at the hospital, it could be at the home, or what have you. So it's doing what it needs to do. And what to show the collaboration that we have in the county, 64 referrals to that crisis hotline were made from law enforcement. So there's that nice synergy, there's that connection. We're working together with that. So through the crisis helpline, there's also the accessibility of a peer recovery individual. So through a contract with Alternative Paths and Hope Recovery Community, if somebody's on the line, maybe they're going through withdrawal or they're just thinking, oh, I'm going to use again, we can connect them. They can connect them with a peer supporter who can speak the language, can work with them right away. So that's been very helpful as well. So over on July 19th, through a contract working with Alternative Paths and their Suicide Prevention Coalition, we implemented the LOSS team. So the LOSS team is, I'm going to make sure I get it right, Local Outreach of Suicide Survivor. So what that is if you have somebody who it goes through with the suicide and the family's there, we can dispatch an individual to work with and help. Now, they're not out there to provide counseling right away or any of that kind of stuff, just to comfort, get them engaged, walk them through the process and things like that. So it's a very powerful program. 13 clinicians were trained in that, and once again, that's in collaboration and working in conjunction with law enforcement. So it's a great program. There's only 22 across the state that have it, and it's just one of those where you hope you never have to dispatch, but in the event that you do, that's there. So let's see. So really, in closing, then, I can't read anymore. Oh, hold on. I have recovery support yet. If you still have a second. So once again, the levy funding, it was critical to help us build up and support recovery supports. As you know, Hope Recovery Community operates out of a house owned by the Adam Board. And we're always looking to expand because they have so many numbers that are coming through there daily. There are 9 peer supporters through Ohio Guidestone that are serving 117 county residents as of today. There are additional certified peer recovery supporters that work directly at Hope Recovery Community. Hope Recovery Community's teamed up with Jobs and Family Services to operate the House Start program. So families that are at risk of losing their children, they have a peer supporter. They work with Jobs and Family Services to re-engage, to get them back, and it's been very successful at this point. There are 97 individuals receiving medication-assisted treatment this last quarter through the open access, just through Ohio Guidestone alone. There are every agency, behavioral health agency through around in the county offers MAT. So that is something, if you recall, several years ago, it didn't really exist. Now there's enough out there where people can get the help if they need it. And then also through the levy funds, we were able to help boost up recovery housing. So Kathy's house has purchased and renovated a new house, so they now have another house that can house up to 6 male beds. It just opened, and they currently have 3 there. So Kathy's house can serve 11 male and 7 female at their main campus. And then now they have another level, a level step down, and they can serve up to 6. Male recovery beds is something that is sorely needed, more of them. They always have a waiting list as well. And then finally, through the Adam Board, our Women's Discovery Recovery House is finally open. If you recall, we built that, COVID hit, and boom. It was more or less in case it was emergency shelter that was needed during COVID. But it's been operational since the end of June. We've had 14 females. Now this is a level 3, so it's a higher level of care that is offered at that facility. And currently we have 9 residents there. So it is hitting, and it's working once again how we can leverage resources. We're working very closely with Kathy's house, who's a level 2. We have a level 3, and we can work back and forth and place individuals or females at the facility that best suits their needs at that point. So Really, in closing, because of the Human Services Levy, we've been able to build a stronger and more effective system of care. Because of all the collaboration that we get throughout the county, from all the agencies, law enforcement, courts, and especially the commissioners, I think that we continue to build upon the successes that we have. And once again, the more choices that we can provide, I think the better that we are here. So if there are any questions, I'm happy to take them. Or
Phil, is the Adam Board supporting Serenity, the restaurant?
Financially,
Yeah.
we do not have a contract with Serenity.
Okay.
We do, once again, that's maybe another option. So when individuals come through our system that may need or may benefit from something like a Serenity or a cooking class or something, then the referral could be made there. We work with a Hope Recovery community to kind of help guide individuals to where they may need.
Okay. And are your numbers, I think you said you had like 5,800 people that were served in the first quarter, 5,900, something like that. Are those up due to COVID, down? How do they compare to prior years, if you recall?
I don't have it here. I might have it in that book, but I think at this point it's probably pretty consistent, because what we're finding is maybe the need's up, but the capacity isn't, right? So we're juggling the workforce, the capacity, and the clinicians. So if we're not able to serve somebody in our system of care, maybe we refer them out to another behavioral health agency that may have capacity at this point. So I think that individuals are getting the help that they need. It's just maybe spread out at this point. And this is a workforce is something that every agency, behavioral health in our county, whether it's a Medina County contracted, Adam Board contracted agency or not, is facing as well.
It's also possible that some of them may be going outside the county as well.
Absolutely.
Cuyahoga County or Summit County, which has more resources, and obviously when you look at the networks of the hospitals and care, obviously it's much larger scale, and quite possibly a number of people go out that way.
Right.
Yeah.
And those are, if we don't have Medicaid data,
Right.
and we fight as an association to try to get Medicaid data so that we can see who's getting served where, so we don't duplicate, but also to make sure that people are getting the care that they need.
Philip and I have a meeting every month, and his department has taken the levy funds and done extraordinary things.
Thank you.
Anything else?
Oh, you want me to keep going? No.
Thank you, Phil.
Thank you.
We appreciate the update. The commissioners have a couple of recognitions here. So 4-H every year recognizes their outstanding high school seniors. And because 2020 was sort of, didn't happen because of COVID, we want to recognize both the seniors for 2020 and 2021. So for 2020, we'd like to recognize the following outstanding high school seniors: Shane Capella, Caitlin Clifford, Olivia Eby, Nicholas Huttinger, Svetlana Post, Caitlin Praisler, Xander Throckmorton, Elise Van Newkirk, and Natalie Young. And for 2021, we would like to recognize Ethan Briggs, Elizabeth Cawley, Madison Miller, and Emily Winnicke.
Emily
They were all congratulated for their outstanding.
Emily Winnicke also won the annual Stephen Josephs Award at the
Yes,
Fair
yes,
Board.
indeed. So we will move to public comment. Does anyone wish to address the board this morning? Seeing no one, we'll move into discussion session. Everybody want to jump up at once? Laura, do you have anything? No? Jeremy?
Just wanted to discuss the grant from the Ohio Department of Development. I had submitted my list of projects over to the county engineer for his scoring and recommendations to the Department of Development. So I just wanted to let you know I was going to go ahead and submit our project so we can at least get our in hopefully early next week. So
So Jeremy, there were 2 water towers and 1 water line, if I recall
There was
correctly.
2 water towers, a generator,
Right,
a water line extension, and a sewer line extension.
Right.
So,
okay. Do you have any idea what the timeline is for knowing when those will be approved or not?
I believe they said that they were hoping to get those reviewed in 45 days from submission.
That would help with the art.
Exactly. Yeah.
Right.
So as we look
Yeah.
at our projects, we have some idea.
Correct. Yeah, I tried to use some of the art projects that I had, and then also projects that were also constructible within the next 6 to 12 months, knowing that that was a scoring factor. So,
Okay. Thank you.
okay.
I wanted to comment, Jeremy has been looking for some alternatives for EMA for their building, and I really appreciate how
Oh, no
hard you're
problem.
working on that.
Oh, not a problem.
And I'm sure Christina does too. Thank you.
Hey, no problem. Thanks.
Hold on, Jeremy. You want to talk about the PA?
Oh, sure.
So,
Yeah.
there was a proposal floating around to modify the map for
Oh, yeah.
sewer services. I know Steve had it.
Yeah, we had actually asked, it was on the NOACA agenda and been proceeding through the various committees, and I guess at that point we asked them to table it. And there was a request back from NOACA, or I guess of the staff there, the water quality staff, as to whether to put that on the agenda for the next several meetings. I know I communicated my concerns as originally still remain as to, as my understanding is that if we end up approving, if you will, reducing and delineating these areas, then in order to, should the commissioners in the future decide that they want to extend the sewer lines there based on, let's say, changing a policy, a lift station or whatever, that it would require then NOACA board approval on modification.
That's correct.
And I've got grave concerns of putting that control within, I'll say, not the technical staff of NOACA, but the political governing board, which is largely, at this point, Cuyahoga County and Cleveland. And
So Jeremy, is there any benefit to the county of making this change and being more concise in the areas to serve?
It just more clearly defines which properties we can currently sewer or propose properties that could be sewered with sanitary sewers as opposed to septic.
So the map, though, from the existing map to the proposed map, sort of shrinks the areas.
It carves out all the areas that we cannot currently service with gravity.
right, basically about 16,000 acres, if I got
So-
the
so-
number right.
I mean, to Commissioner Hambley's point, if we agree to the proposed revision, I mean, if we ever wanted to sewer a specific property outside of those areas, we'd have to go back to NOACA for approval.
Correct. We'd have to go through a
So
prescription
is
amendment.
there any real benefit to restricting the map?
It sometimes helps when you have development that are outside our fringe or outside of the gravity areas. It just helps clearly define, hey, these are properties that we can definitely service and not service. We do run into these prescription amendments currently. I know we had one for Skyline Golf Course more recently, and then there was one off of Route 3 near, I think it was Hamilton Road there.
Okay.
Where they there was a subdivision where the only way that they were able to get service to these properties was through acquisition and easements. So they were able to acquire the properties, and so we had to go through the prescription amendment on that.
The map does clearly define for developers then.
Well, and I
Yeah.
absolutely agree, and I think that's, actually, I ended up running to the, I guess, the young man does all he was working at the booth, the sanitary, over the course of the fair, and talking to him and all the work that was put into doing this, and I absolutely applaud the sanitary engineer being able to do that. My question comes down to, can this basically be a commissioner-approved prescription without having NOACA basically putting on their plan? But in other words, this is the map that we have approved. This is the one that when you go on the website, this is the commissioner-approved prescription area. And that's in my mind, that's where the developers go. This is where we have the property owners know that based upon current policy for gravity, this is where we're going to have potential for sewers expansion. Here's the area that is not approved. But that's what we communicate to the public and the developers and property owners. And first and foremost, that's the most accessible, especially with websites. When you go to that map, you shouldn't even see the other map unless you go really deep down.
Yeah.
But if I understand correctly,
Yeah.
the existing map includes areas that are not serviceable by gravity
Right.
sewers.
Correct.
So
But-
that map may be somewhat misleading to the developer that
Well-
goes to it and says, look, it's red, so
Well-
I can do this here,
Where would they get that map?
when in fact they can't.
Well, the question comes down to is how accessible. It's not like we're trying to hide it, but the first map they see is the one that's approved by the county. We clearly indicate that this is the one that, under current policy, where you can. And when you go in there, developers and property owners are not going to look much deeper if they know, unless they, of course, and we could put it in there, that they need to contact the sanitary engineer's office to make sure that they know.
I
Yeah.
asked Amy some questions on this topic. Did you have anything to add historically on where?
Only that I echo Jeremy's comments because it streamlines developer interest. They
Sure.
could be considering multiple properties in the
Right.
county for prospective development, and that will help them narrow down areas that are easier to develop in terms of utility service. Sometimes challenges that they encounter would be, annexations or inability to serve. And the technology we now have available through GIS to provide that level of detail we felt would be beneficial from the start. We oftentimes don't speak to a developer until they're already negotiating with property owners, and then occasionally it's reflected poorly on the department when we can't serve because there's a misunderstanding out there that utilities may be available. So it was meant to not only reduce acreage to demonstrate serviceable area, but also to add in some areas to be reflective of those that were in the works for service. As Jeremy described, those that could have been accessed by easements and other arrangements they've been able to make successfully on their own to realize the value of that property.
Can't we make that map the first one that they see?
You can, but the map that is on record and the one that is coordinated through NOACA in their planning role will
Right.
differ from ours.
And the Ohio EPA.
And the Ohio EPA. So right now, do you want to expand on that, Jeremy? On the
Yeah, so a lot of times if the developer doesn't call us first, a lot of times the first time I see it is on, like a concept plan. So then at that time we look and then we compare that to the FPA map and to see, make sure the prescriptions are good. If the property they're looking to develop is currently a septic line, a septic property, we have to go through NOACA's prescription. We could provide the service area map, available to the public, but the map that everything gets, that the Ohio EPA requires is off of the NOACA's approved map.
So you're recommending the change?
It would be nice to just, again, just be straightforward with the property owners. However, I understand your argument or your point that it does, anything that does need to get changed has to be done on NOACA's end for any type of change.
Right. Jeremy, you mentioned getting the concept plan from the developer. Does that concept plan come to you after the developer has purchased the land?
Sometimes I usually get them through planning, and that's usually in the unincorporated areas. But yeah, when that'll be the first time that I'll see a project. Sometimes.
Does Economic Development Corporation get involved with some of these? I guess that would be more of the commercial than the residential, correct? Development.
We're getting our share of residential inquiries these days.
Okay.
We try to limit it to, what's available from an industrial standpoint. And,
Right.
that is one of the issues that we run into is, are there adequate utilities or ability to serve those communities?
Right.
So, I think it's a very important question with the map. I do appreciate the work that you're doing, and, it's good to be precise, but I also, having run into NOACA, completely understand the desire not to have Medina County development at the mercy of Cuyahoga County politics.
That's, I don't know, heavy price, in my mind, it's still a heavy price to pay for, I'll say, to have more clearly communicated as to what we're going to sewer and what we're not going to be able to under current policy.
So I guess, and I'm not sure if this is where you're headed, Steve, could we have our own map, separate and apart from the NOACA map that says,
We could, yeah.
here's what we're willing to, or able to sewer?
Yeah, we can have a serviceability map based on certain criteria. I mean, obviously, it's only as good as some of the information that we use to create it. But yeah, I would give it at least a good general idea.
Isn't also the original purpose of the 2-8 water quality map, as I understand, was also to help you develop your population growth statistics. The facility planning area basically is when you're looking at that facility, deciding as to what the potential growth might be. And so when you get your permit for your wastewater treatment plant and so forth, that you're actually making sure that it's sized appropriately for that geographic area. My recollection is, over the years, having served on the NOACA board as well as chairman of the water quality, the whole idea was to use a broader brush, not a real refined brush, if you will, a fine pen to define that area, because you're using population growth statistics to determine the size of the wastewater treatment plant that you want to build if you need to expand and provide for it. And so that was, at least in the 90s and 2000s when I was there, the idea was to make sure that just primarily for planning purposes of not where you were going to put the sewer lines, but where exactly how large the sewer plant was going to be.
Yeah, in my conversations with NOACA staff, they're hoping they're asking us to get a little bit more refined in that.
And I understand the drive for refinement. It has to do with still sewer capacity. Likewise, then you start getting into these development issues and who controls them. And so that's like I said. But I understand what the original purpose was more for planning of a, if you will, a system or numerous, let's say, facilities that you ended up utilizing, and make sure you had enough sufficient capacity for that growth. And I think what they use the 20-year, do they use the 20-year population growth number, or
in this, likely sewered in 20 years at least.
Exactly. And so they use like that. So it's meant to be a general planning tool, not one specifically lot by lot. That was what Ken Holtz had preached to me early on when we were growing so fast in the 80s and 90s and so on. Not 80s, but in the 90s so fast. That was the whole concept, to help, not that we were actually going to run a sewer line down a specific corridor or road. Now we're changing the purpose of that plan to specifically identify parcels, and I guess that's where I end up kind of look at the history of it, and giving control to some outside entity to do that still bothers me.
Your point is well taken about that. I agree. I would also say, though, that if you're planning your sewer capacity based on, I use your number, 16,000 acres that we can't sewer, you're gonna develop more capacity than what you can actually use.
But that's that's where you end up. Like I said, as I understand, the EPA, when they do the certificates, that's your cap, not necessarily your design. In other words, if you decide that you're not going to do less, when you submit the design to EPA, they're not going to look, and they'll basically evaluate that. And you can actually more delineate it when you get your certification for the wastewater treatment. So as I understand, there's still some judgment that can be put into that number. The idea was to make sure that you do have, if you do plan on extending, that you've got the capacity. So, like I said, who controls it is whether we control it or we allow another entity, whether it's Ohio EPA or NOAC or somebody else, is the one I don't want to trade as a future, seeing a future commissioner come in and I'll just say wanting to dig us up and kick our butts because we ended up not enabling them to expand sewers where the community or the commissioners have decided really deserves an expansion or a modification of a policy that involves lift stations.
I saw your hand partially raised. Did you have something else you wanted to?
Well, and I think Commissioner Hudson addressed it to some degree too. It's, when that broad brush approach was taken back in the day for delineating the service areas for wastewater treatment plants, we had large agricultural parcels that had not yet been developed. Over time, as those developments have come along, what we have found is that there were zoning changes and the density of development on those properties in the county exceeded expectations. So capacity does come into play, and it is an issue. So whenever we are looking at departmentally considering areas of growth, it's in part also reserving capacity for those that can be served by gravity but have not yet been developed. So there's a fine line, you know, between that determination, and I think the map, and I understand all points being made, I just found the map to be helpful in presenting that forward thinking to potential developers.
So when you say the map, are you saying the existing map or the future map? Or the proposed map, let's call it that.
I'm referencing the proposed map because I think too that, at least at the time it was developed, met the intent of NOACA's ask that we be more specific. They get engaged sometimes when we show an area that looks as if it could be served, and then we say it can't. So they participate on both sides, I guess, of the talking table. So,
And these maps are done every 5 years.
I'll point out, we're the first county in the NOACA region to have this. The other counties do not. Lorain County doesn't have this, right, prescription, this kind of refinement.
everybody does,
yeah.
and they're looking to follow the Medina County.
Yeah, we're the first.
There was,
Yeah,
no, see, there
yeah.
was another one that was on the agenda at the same time ours was. We tabled ours.
Oh, yeah, but that was just
And
changing facility planning areas. It wasn't due a prescription, was it, on the basis?
I thought it was Lorain County for some reason.
I'd have to look that one up.
I'm not 100%
Okay,
sure.
all right. Yeah, okay.
But it sounds to me like it would be better from a development standpoint to be more specific and to allow the developers to know with some degree of certainty that they can in fact develop the property with sewers.
I would agree.
I guess I would support it, the amendment.
I had asked Amy when she was near my office a bunch of questions, and I would too. I think it is, no matter how much we advertise, I think it's the first place the developers go. No matter how much we would advertise, like our own map creation. I think it's just, especially a developer maybe coming into our county for the first time, I think the NOACA map will be the first map that they go to.
Well, I've stated my point.
Okay, all right.
We'll see if history proves us right, later on.
When you hear that shovel coming.
I'll be buried in concrete.
We can put you in the time capsule.
Thank you, that's right.
It'd be a sledgehammer then.
All right,
Okay, thank you, Jeremy.
Thank you.
Okay, so, Amy?
If I may.
Sure.
This does not require board action, but I did just want to update you on the ARP funding. Comments were due on that interim final rule in July, but there is still no word on when that final rule itself will be published. Jeremy had referenced other funding mechanisms, and we've had several conversations in our circles about other monies becoming available. So just one concern I have, and I recognize it's shared by the board, is that some of the projects that we are considering or that are being discussed next week during the presentations and the scoring and so forth may have sources of funding available through other streams of revenue that some may not. So just a point about that lack of final rule and any impacts that they may have on the decision making. And then also to let you know that the first interim report is due August 31st. So we'll be working with the auditor's office through the web portal. The only subgrant so far that the commissioners have authorized that had fit that time frame was the $125,000 subgrant to the Fair Board. So with the successful completion of the fair, I'll be working with their team to pull together all of the documentation that we have to support that the money was spent in accordance with the guidelines on proper items and so forth.
So the county home stuff doesn't make the timeline because we haven't spent the money yet.
Correct. So that'll be on our next report, which would be due October 31st. But the criteria for this is very different than the CARES Act dollars.
I was talking to Scott, and it seems like the only slam dunks for the rules that we have solidified so far are sanitary projects for Jeremy and like fiber projects. Otherwise, the definitions it's very difficult to solidify the definitions. until we have those final rules, but those two categories seem like slam dunks according to the rules.
Which then just would call into question whether or not they could be funded through other means, leaving
Right.
monies available to spread the
Do you not
wealth.
know that the HVAC, the total, those fit the criteria?
They improve air quality in congregate settings.
Right.
So yes, so those resolutions were approved, and those are being worked through the Equalis state purchasing program. So those are underway.
So we're confident on that one as well, aside from the
Correct.
sanitary sewer and the broadband.
Correct.
So we do have at least some that we know that there are certain amount of based on what we realize.
We don't have as many new projects to grade though in
Exactly.
that area.
Well, exactly. Well, I
Right,
think,
yeah.
obviously, I think it is important for us to hear and have a better understanding of each of these proposals, and likewise sort out, but not make any decisions yet until we know how the other funding sources are coming through, at least for this year.
And Amy, to that point about the other funding sources, is there any indication that there would be any problem? Let's say one of Jeremy's water towers, he gets the 50% match from the Department of Development, or not match, but that grant. Can we use then ARP money to make the match? Is there any restrictions on that you know of?
Not that I have yet identified.
Okay, so we could in fact fund an entire water tower or more through money that is channeled through the federal government in one way or another.
Correct.
Yeah, I talked to a representative from Representative Gonzalez's office, who had been following a lot of this, and he indicated, which is unusual, but it is possible to use federal money to match federal money, which is not typical,
Yeah, right.
but in this circumstance, appears that this is within the rules right now, and was the intent of Congress to allow that. So at this point, you're exactly right. I mean, we'll be able to use one right and left pockets, if you will, of money, both with the original sources being, we'll just say, the federal government borrowing all this money from our children and grandchildren.
Right.
So, yeah.
Thank you.
I have my grandson and granddaughter in town. Maybe I should make them give me a quarter every day.
You're second in line. You're second in line.
Okay, thank you, Amy. Oh, and so next week, on Tuesday and Wednesday, we are having meetings to review projects. I don't have the specific times. Do you?
Rhonda made a schedule. We have a
Yes,
schedule.
yes. But I didn't. I was going to bring it with me, and I didn't. But anyhow, those will be advertised, and if anybody has any interest in attending, you're certainly welcome.
And these will be live as well, correct?
Yes.
All right, so
Yeah.
people will be able to watch us from the convenience of wherever they're at.
Right.
As long as they've got internet.
I think they'll be similar to like a budget hearing.
So unlike the people in the western part of the county that have no internet or broadband.
Right.
But
Yeah,
might have
we're
real
working on
interest
that.
in those hearings on broadband.
We're almost there.
Almost there, yeah. Well, you're in the southern part. We've got some over in like Buckeye School District and so forth that are, very poorly served.
Right, right. Bethany, do you have anything? No? Denise? Christina? Ally? Amy? Steve?
Nothing else?
I'm good.
So I got just a couple things. First off, Medina County Fair concluded.
Yes,
Was
it
a
was so
fabulous fair.
nice.
I could not believe the number of people that attended, and I could not believe the traffic. It took me an hour to get from the corner of Lake Road and 42 to the main entrance to the fairgrounds in 42, and when I got there, they said the parking lot's full, you have to go over to Smith Road, and it took me another 20 minutes to get there. So, great attendance, and Fair Board did a really, really nice job in managing the fair and
And Monday
keeping
through Friday, the
everybody safe.
weather was fantastic
Yes.
for them.
Thank God the weather.
Right.
Really
It was good. It was good. And then we have a couple of term expirations on the Medina County Board of Developmental Disability. And Elaine Orlandi and Chris Matty, their terms are both expiring at the end of the year. Rhonda, do you know if they've indicated an interest to continue, or?
I have not heard.
Okay. So
Typically,
anyhow.
we advertise for those, so I'll get the publications, ready to go in the Gazette and get it posted on the website.
Would you like me to ask Stacy if they want to continue? All right.
Sure.
Also, we have the library one.
Yep.
Were we considering
Yes, did you advertise for the library?
It's scheduled to be advertised.
Okay.
Did we contact the one that had interest before?
I believe that person is not going to apply for renewal.
Okay. Oh, no, I'm talking about the one that had interest in the last time we had the library.
I did not.
Okay.
But I will.
Okay.
I wanted to wait until it was advertised.
So there is an opening then, likely, on the Medina County District Library
Yes.
Board for appointment? Okay.
Well, I think too, with advertising, and then if there is anybody that also wants to apply,
Right.
obviously these are,
Yep.
I know it's not an open seat, but obviously I think we had to review all applicants.
Yep.
Yeah.
So, and you're going to advertise on the website and the paper?
Yes.
Okay, very good. I don't have anything else. Anybody?
Move to adjourn.
Second.
Roll call, please.
Hambley?
Yes.
Sweattick?
Yes.
Hudson?
Yes. Thank you and have a great week.